Tyler Shough. Tyler Shough. You don't even know his name.
What the hell?
Tyler Shough.
Tyler who?
Tyler Shough.
Shough.
Wow.
Shough Knight.
Exactly where his game
Shough.
is, and
Shough Knight.
will help you as either a quarterback.
All right. We're going to talk about broken collarbones, clavicle fractures. So, Tyler Shough. Man, I thought my name was difficult for some people to get right. My name is phonetic, Okumu. I've got about 15 aliases because people can't pronounce it. I don't know, it's phonetic. Shough, S-H-O-U-G-H. Wow, okay. That's different. Anyway, as you guys know, Tyler Shough, the transfer from Oregon, now is at Texas Tech, quarterback. He fractured his clavicle. He broke his collarbone. Now, back in the days, and actually I think now, back in the days we didn't operate on collarbones, right? Because they would always either heal or they would form what's called an asymptomatic non-union. So you get a bunch of fibrous tissue that kind of holds everything together, and it was asymptomatic, didn't have pain, right? So you may have seen people who had broken collarbones in the past, didn't have surgery. They have a big bump where that the fracture was. That's the that's most likely the asymptomatic non-union, or they may have actually healed that bone, but there's a lot of callus, a lot of bone scar around the area. And, people are doing okay. They didn't have pain. And then after some time, there were a lot of orthopedic surgeons in the UK in particular who started fixing more of these because they, fixing, we say operating and, stabilizing these things, orthopedic jargon. Anyway, they started fixing these collarbones because of a number of reasons, right? One, not all non-unions are asymptomatic, and not all the collarbones did actually fuse, right? So that was an issue. They also found that if these collarbones were shortened, when they healed, you lost some power in that extremity. So if you're a quarterback, and it's especially your throwing arm that has the clavicle fracture on that side, would you want to have a little less strength in that arm? Probably not. So I imagine, and I actually fixed a collarbone on a cyclist recently because, again, didn't want to lose any strength in that. It's not much, but there is a difference, right? So I imagine a quarterback, they're going to fix that. So that's probably what's going to happen with him, right? And he'll have to be out for, what's the magic number I always say? I don't know, 6 weeks before he can start doing rehab, 3 months before bone is healed. But I imagine that's why he's going to be out until November. So the way these collarbones are fixed or operated on, it also depends on the type of fracture, right? There's also another type of collarbone fracture that you really want to operate on. Most of them happen right in the middle third, okay? So right in the middle of the collarbone. And you operate on them if they're shortened, if they're displaced, more than 100%. So if it's broken, but the tips are still aligned, you don't always operate on that. If it's moved, if it's displaced, in other words, 100% is displaced, the bones aren't touching at all. You want to get those bones back together so they can heal. Or if it's shortened, remember I talked about how they can lose some power in that extremity. If it's shortened, you change the lever arm. You guys, I'm not an engineer, but you guys remember lever arms and so forth. That's changed. You change the biomechanics around that shoulder. You change the biomechanics around that extremity. You're going to lose some power. So he is likely going to have a surgery. Well, they'll take those ends of bones and they'll put them together, put a metal plate on top of it, and fire some screws across that to hold it together. And people feel better right away because they don't have a broken bone that's moving around. But you have to let that bone heal, right? Now, sometimes you have to take that plate off because there's not a lot of soft tissue covering that. It's just skin and a little bit of tissue over that. So it can irritate people's skin, especially people who wear backpacks, I imagine, possibly even football players because of the pads and so forth. But you sometimes have to take those out, okay? I wouldn't take it out until at least 6 months to a year after the surgery, because you want to make sure that bone is completely healed. If you take it off the plate too soon, the bone's not strong enough because some of that load has been borne by that metal plate. Take the bone out take the plate off too soon, that you could refracture, right? So they're obviously not going to take it out in Tyler, Shough Knight. They're obviously not going to take it out in Tyler in November, but he may end up getting that thing taken out later if it bothers him, right? And that's a quick surgery, little incision, pull it out, sew them back up, and they're good to go. The other type of fracture I said that they almost always operate on is a distal clavicle fracture. So if it's all the way in the other end of the clavicle, those ones really can tend to displace and really move up like this. And they can tent the skin, which is the other indication that you'd be operating on these. By tenting skin, I mean is that sharp end is pushing up the skin. There's not much of soft tissue there. Poking up against the skin, there's a possibility I think can poke through. You don't want that to happen because bone sticking out is not good. I think everybody knows that. So in that surgery, you again put that down, and it's a different type of plate that kind of hooks under the acromion process to hold that down, kind of like that, right? And same thing, sometimes you have to take them out because it bothers people. But it gets the collarbone lined up, it gets the length out to where it needs to be, and the person, heals that fracture, and then they do okay. So he'll be back, he'll be playing. I'm not sure which side it was. Is it a throwing arm? I don't think there's much in the online that they're talking about, but I imagine this is probably on the throwing arm that is the reason that he's going to have this surgery. I mean, it could be on the opposite side, and they want to stabilize it enough for him to be able to play, right? But I imagine it's probably because it's on his throwing arm. They don't want him to lose strength. So he's going to have it fixed, put a plate on, and he's going to get back in the game. There you go. Tyler Shough.